Hi, everyone, and welcome to the National Equine Conference call. I thank everyone for joining us today, especially our speakers. And as always, I welcome any speaker or topic suggestions for moving forward. Our next call will be on July 11th. And again, any recommendations are welcome. And we've got a few more people. Hold on, let me just admit some more folks. Seems like a popular topic today. So again, thank you for joining the National Equine Conference call for this month. I am Katie Flynn. I am your facilitator for this call. And we are going to get started with this call. And you should have received the agenda this morning with the change in times for our speakers. And so first off will be Dr. Joe Fish, who is with the Florida Department of Agriculture or State Veterinarian's Office, and he's going to give us a CEM case update. Take it away, Joe.
Hey, thanks, Katie. Thanks for adjusting the time for those that had to adjust for me. I do appreciate it. I'll jump right into it. We had a 11-year-old domestic pony mare that was bred to a 3-year-old pony stallion in the Central Florida area on May 10th of this year. After breeding, they were taken to a veterinary hospital for possible embryo transfer of any pending foal. That hospital noticed retained free fluid in her uterus, treated her by uterine lavage, collected that, sent it for routine bacterial culture, which then came up with a presumptive T. equigenitalis. Off of that presumptive, it was sent to the National Veterinary Services Laboratory in Ames, Iowa, where they were able to confirm that bacterial culture and give us a confirmed positive for our contagious equine metritis case that we're talking about. On May 31st, NVSL, so then we went back, of course, having the mare positive, test the little pony stallion that bred her. And then on May 31st, that was confirmed positive on bacterial culture as well. Luckily, this facility had banked serum that was able to show that the mare transitioned from negative on complement fixation on the pre-breeding and showed that she became positive after breeding. So it shows that the pony stallion was her source of infection. As that epi work continued, we had on June 12th, so this is really current information. You're getting it, I guess, here first, maybe second, depending on if it's updated somewhere else. But NVSL confirmed a 6-year-old pony stallion on the same index premises as positive for CEM as well. That stallion and the first pony stallion were collected using the same AV 1 day apart in May. The affected mare and all of the little pony herd is under quarantine. The affected mare and one of the affected stallions have completed the treatment for T. equigenitalis and are waiting their 21 days before they get retested. The second pony stallion is starting his treatment either earlier today or in another hour or so. I'm not sure exactly where that is, but it's getting worked on.
I'll watch it.
And
if not, that's okay.
Sorry. Okay. There are 4 other potentially exposed ponies on the premises, 2 stallions, 2 mares. Those have started their sample collection testing, all right, and we are waiting on results. The first pony stallion has been traced back to a farm of origin in Polk County, Missouri, where he was foaled in 2021 and remained there until August 2023. His dam, which is a pony mare, is the only potentially exposed equid on the premises and is currently scheduled for testing. We are still working on the epi for the second pony stallion, and that will be forthcoming as soon as we can get a little bit more information. I think Katie wanted me to talk about the procedures for testing during an investigation. And they are a little bit different than, I don't know how many of y'all are familiar with what the normal for import is. But I'll assume that we don't know that much since it's a pretty wide audience. So for exposed stallions, you take 3 sets of cultures rather than just 1 set of cultures. And we take that from the shaft of the penis, the prepuce, urethral sinus, and shaft of penis or prepuce and prepuce, urethral sinus, fossa glandis, and distal urethra. Use 4 different culture swabs, and they're all submitted. And then we do those 3 at least 72 hours apart. And then if those are negative, then we would proceed to test breed the stallion twice with mares that have been qualified as test breeding mares. So those mares have to be domestic in origin and have to have gone through 3 sets of cultures, also taken at least 72 hours apart, but within a 12-day period in total, and also have a negative complement fixation test. So at that point, and that they get some sort of identification, whether that is there's a T tattoo that they can get a brand, they can get a microchip, but they get, once they have those, then they are qualified. We like to qualify them on site where they will be used, or they can be, if they're qualified somewhere else, then they can be transported under a VS 127 to the site that they will be used. Then we have so treatment for if you have a stallion that is positive, the same as we would do on import. We would clean them with chlorhexidine very, very well. And then we would put on either a nitrofurazone or an SSD ointment. And that would be for 5 consecutive days that they would get that. They can go on systemic antibiotics. Same with the mares. It is not required. So it's a veterinarian decision if that's what they so choose to do. After they undergo treatment, they've got to sit around for 21 days. And then at that point, they can begin the 3 sets of cultures again. Once the 3 sets of cultures return as negative, then they can breed, and then they could go and begin the test breeding of the animal, or of the mare, I'm sorry. I think I've already covered the initial procedure for qualifying test mares. And then, so she's qualified, they do the test, the test breeding, and then counting the test breeding as day 0, you would culture the mares on day 3, 6, and 9, or at least starting day 3, and then 72 hours apart. And it can be within a 12-day period. That way we're not shipping on weekends or shipping on Friday for delivery on Saturday. There is some flexibility there in that, and I think that that's good. On 21 days post-breeding of the mare, we submit a serum sample to NBSL for CF testing. That's pretty standard even with import. The little bit of difference here is we reculture the mare at 28 days post-breeding. And that's something that isn't necessarily done on import. So that's another little tweak there. If those are all negative, those can be, if you had multiple stallions to test out, you could use that mare again, and those be the pre-qualifying samples to get her to qualify her again as a test mare. There's also non-pregnant exposed mare. This includes to artificially inseminated mares and embryo transfer recipients. Because in some of the previous outbreaks, they have shown that extended semen did transmit CEM. So concerns there. So for culturing, so you CF test the non-pregnant mare basically as soon as you can. And then you culture the non-pregnant mare at day 1, 4, and 7. So again, 72 hours separating. There is the expansion. You can do it as little as 7 days. You can do it in as long as 12 days. If you need to clean, it's water only to try and remove any excessive organic debris. That is true for all of those. I guess I hadn't said that before. But there's no cleaning them up with chlorhexidine before. Obviously, that defeats the purpose. After you swab the clitoral sinus and fossa, you clean and disinfect. Well, you want to wait for all the cultures to come back again. A little bit different. So I don't know that I want to tell y'all. Well, so Florida will take 4 sets of cultures in case one of them gets lost in the airline or has overgrowth. It's a little bit of a risk. Here, there's no risk taken. We're going to slow walk it. So you're going to take your 3 samples. You're going to wait for all those to be reported out negative, and then you can begin the cleaning and such like that. So treatment of a pregnant mare, there's 3 different options there. You can do preliminary testing for a foal with endometrial testing and treatment post-foaling. So at that point, you would take your CF test as soon as you could, and then you would culture the clitoral sinuses and fossa. Again, that 7-day, 72-hour period apart. And then post-foaling, you would culture the endometrium after cleaning and disinfecting the vulva and peritoneal area of the mare. And then you don't begin treatments until the results of that is returned. Let's see, and then there's post-foaling after endometrial culture, and then you treat the mare for 5 consecutive days. So on day 1 of treatment, infuse the clitoral sinuses with small volume of seromucolytic agent, and then using a 12 cc. Well, we won't get in. That's probably too much detail for this. You express the bean, and then flush the sinuses with that agent. And then after flushing the sinuses, you treat it with either the SSD or the nitrofurazone. And then day 2 through 5, you repeat the same procedure. But you don't have to express the bean because the bean will come back in a single day. Katie, how am I doing on time? Am I going in more in depth than you wanted, or?
Yes.
Nope, you're doing good. I just want to bring to your attention that there are some comments that are applicable, so I'm just going to read them right now, and then some questions that you might be able to answer.
Okay.
First of all, Dr. Angela Pelzo-McCluskey with USDA did post that what Dr. Fish is describing is the USDA APHIS testing and response procedures for domestic CEM incidents, and they have updated version of 2024 that Dr. Pelzo-McCluskey can provide to those that are interested, if you email her at angela.m.pelzels-mccluskey@usda.gov. So these are the new protocols for 2024 if you're interested. There was a question about how is the T. equigenitalis metritis treated in the index mare, and Dr. Pelzel-McCluskey did answer that, and I'm reading this because it's in, there are some folks on the phone and not on Zoom, so they can't see this. So multiple days of uterine lavage and antibiotic infusion, usually Genocin, and then 5 days of a chlorhexidine scrub and packing with furazone or silver sulfadiazine, as Dr. Fish mentioned. And then there was a question about whether any of the ponies identified so far were imported to the US. And Dr. Pelzel's response was no imported horses identified as involved in this incident at this time, but they're early on in the investigation. And then I received 2 additional questions, Joe, that you can cover. The pony mare, was she live cover or artificially inseminated?
The index pony mare was live cover.
Okay, and I think this has already been answered, but the question was, is the 6-year-old pony stallion a domestic stallion?
Yes, as far as we know, everybody in the pony herd is a domestic pony. One other thing I forgot to share whenever I was going down, and Angela's way better than me on all of this, but this isolate that we have is not known from any or related. Well, I won't say related to. It doesn't match any of the 7 previous outbreaks that we have had. And
that was the next question.
Yeah. Okay. Yeah. So if we want to get into clades and all that, then I am going to refer you over to somebody far smarter than me, which would be Dr. Pelzel-McCluskey, and she can answer all of that because you don't want me answering it. I'll just confuse the heck out of everybody.
So I would have deferred to Angela then, Joe. So Angela, you got anything to add to it?
Sure. So as Joe said, we have an extensive library of Taylorella equigenitalis at NVSL that we've amassed over the years, both from our domestic incidents, from our imported horses that have come in and been affected. And also we've gathered samples from around the world as part of our library. And so far, this current strain of T. equigenitalis involved in the incident does not match anything that we have on file directly. So definitely not connected to any of our previous domestic outbreaks, but it also doesn't match anything we have in the library. The closest we have is that it's in the same clade as a couple of United Kingdom samples that we have in our library. So we're still investigating how closely related those actually are, but they're not a direct match. They're just in the same clade at this time.
Good information. At this time, Joe, unless you have anything else, I'm going to open it up for any other questions or comments that we might have. Is that okay?
Sure. Yeah.
All right. Does anybody else have any questions or comments? You can unmute your line or you can put it in the chat. Okay, this is going to be way beyond my understanding of this question that's being posed. Has it been estimated how many evolutionary years away from a known sample it is? Angela, I'm going to defer to you.
We do not have the information at this time. So guys, we're really early on into the whole genomic sequencing of this. And as you know from previous outbreaks of CEM, if you sort of remember our summaries in the past, this is actually the first time we've been able to do full whole genomic sequencing on these isolates to compare them really specifically to our library. In the past, we had PFGE, we had some other things involved. So we're still really digging into how related this particular strain is to many of the other strains that we have. So give us a bit of time on that. It's not like TB or brucellosis. Okay. We're a little slower on that. And this is a pretty big genome for us to have a look at. So we'll get back to you on that.
I do have another question that came in. It came directly to me. What happens with any Banks arm samples from the affected stallion?
Yeah, they're quarantined, and they cannot be used until we identify exactly what years each stallion that's positive was affected. They carry this organism for pretty much a lifetime until you physically remove it. So figuring out when they actually got infected, contaminated really, it's not a systemic infection, but when they got contaminated and what years that contamination was present so that you can identify which banked semen, frozen semen can be used or not used. And if we cannot determine, then it cannot be used. So that semen is quarantined where we find it and have it. And in some instances, we have tested it in historic outbreaks to determine whether or not it was infected. And in many cases, we do find organism in those frozen semen samples. If the stallion was actually affected during the year those samples were collected. So those are dangerous samples. They are quarantined and they are not used or they are destroyed.
I have no other questions in the queue on the chat. Are there anybody on the line? Hearing and seeing none. Joe, you're off the hook for the rest of this call, but I'm sure we're going to ask you back for updates.
Sure. Thanks, Angela, for my phone a friend assist.
Okay. All right. We'll move on now to our next speaker will be Julie Broadway with the American Horse Council to give us the recap from the recent American Horse Council National Issues Forum. Julie?
Well, good afternoon. Thanks for the invitation. Katie, am I coming through okay? Okay, great.
Yes, we can hear you.
Perfect. Before I start a rundown of all of the 27 guest speakers we had at the conference, it was a really, really great conference. I want to begin by making all of you aware, if you didn't know, that Dr. Katie Flynn was the recipient of our annual James J. Hickey Jr. Award. This award is given in honor of my predecessor, Jay Hickey, who was the president from 93 to 2016. It's presented to the individual who has been a great supporter for the industry and the Horse Council, and they must exhibit a history of service and leadership to the industry, made a lasting impression, and given willingly of their time and expertise with the goal of helping the industry. And she's in rarefied air by getting this award because the previous recipients were Dr. Marvin Beeman, Dr. Josie Trop-Dargis, Dr. Peter Timoney, and Dr. Jerry Black. So throw your congratulations into the chat because Katie was very, very deserving of this award, and we're so delighted to give it to her. So kudos, Katie.
Thank you, Julie. I didn't ask you on the call to say that, but please continue.
Yes, your colleagues need to give you those kudos because it was very deserved. So this is takes at least months to put together this conference, but I was so pleased with it. On Sunday, we kicked off the conference with a panel discussion on social license to operate or social license to thrive. It was moderated by David O'Connor and included Dr. Jim Hurd, Dr. Kent Allen, Dr. Shana Spurlock, and Jennifer Toussaint from the National Animal Control Association. Really great discussion and dialogue. This panel discussion was filmed, and we will share that video with anyone who has an interest in that. A couple of you that I see names out there were there for that session. If you want to throw in any comments, feel free to do so. But I was really impressed with the dialogue of the participants. The room was packed, and everybody seemed really engaged on the subject. Okay, I'll keep going. Next up, we had our Coalition of State Horse Councils. We concentrated that subject on a grassroots advocacy presentation. We had a guest speaker come in and talk to them about the importance of grassroots advocacy and what can be done there. So really good conversation around that. Monday was our National Issues Forum, a full day of speakers. We began with a AHC, American Horse Council, legislative and regulatory update. I have those slides for anyone interested in that. We outlined our priorities for legislation and regulatory issues this year. We followed that with an advocacy playbook panel, which included 4 different directors of government affairs from other associations so that the industry could learned their tips and tricks for good advocacy models. And we heard from Dr. Mark at ABMA, Burton Eller from the National Grange, Ryan Yates from American Farm Bureau Federation, and Jeff Evans with the American Society of Association Executives. Really, really nice panel discussion. That was followed by a conversation around economics. And we heard from Todd Van Hoos, the president of Farm Credit Council, and myself, who gave the statistics from the recent National Economic Impact Study. I've got all those slides available for anyone interested. And before lunch, we heard a very moving and powerful panel discussion on equine assisted services. Myself, Kathy the CEO of the Professional Association of Therapeutic Horsemanship, Kathy Blaine, the program manager at Loudon Therapeutic Riding, and one of her veterans who is involved with their equine assisted services at Loudon spoke. And in 2017, when we did the National Economic Impact Study, was the first time we really measured this little segment of the industry. And in 2023, I'm happy to tell you guys that equine assisted services has more than doubled in economic impact and participants and jobs since 2017. So this is a very growing field for us, and a really great conversation about not only the benefits to able-bodied but disabled-bodied individuals. And Karen shared a very moving story about her experience in the military and her struggles with PTSD. Equine assisted services really helped her get her feet back on the Our racing committee topics this year included an update from Alan Foreman on the Maryland Racing and Pimlico and the redevelopment of Pimlico. And we also heard an update on unsanctioned or bush track racing. Dr. Paula McCluskey brought this to the American Horse Council's attention a couple of years ago. We've been monitoring it. And this summer we had an intern who did an in-depth research project on this. So we've now identified how many states and how many unsanctioned racetracks are out there and some of the issues that are involved. The American Horse Council is working hard with the state attorney generals and the National Sheriff's Association and a couple of other groups to see if we can get a handle on that. I think one of the best conversations at the conference was the equine, the veterinary workforce development panel that we had as part of the health committee. Dr. Paula Parker from ABMA, Dr. Eleanor Green from the Lyon College of Veterinary Medicine, and Dr. Catherine Garrett of AAEP led that conversation, and each talked about what their organization has learned about the challenges with the veterinary shortage and what programs they're putting in place to try to help with that. And they left the audience with some challenges of things people in the industry can do to help with that. So a really nice conversation. Our Equine Welfare Committee was a fascinating presentation by Dr. Michael Murphy of ABMA and Dr. Emily Cornwell of FDA on equine euthanasia and disposal. I have their slides and I'm happy to share that with you guys because they had some fascinating research they've done and some ideas about where they want to go forward with that. They challenged the audience to give them some advice about how to further move some of the initiatives that need to be done to help with these challenges. We closed Monday with two fascinating presentations on innovation and technology. First, we heard from Juliana Chapman. She is the tech equestrian. She has her own website and blog, and she reviewed a number of solutions and apps that are out there for various different roles in the industry, and that was pre-recorded, so I have that video. And we also heard a great presentation from Fatima Terry. She's with the USDA Digital Services Department about some new technology improvements that are happening at USDA. And I think Dr. Flynn and I both became her best friends because we're going to be all over her to see how we can leverage some of the mandates that they've gotten from the administration about improving technology. Katie, you want to add anything to that?
Yeah, I think a lot of the things that they're trying to work on are things that have being worked on at the USDA general level that needs to go down to the APHIS veterinary service level. So this is she's at the top level of the administration for USDA, and they need to work with all levels of USDA. Specifically, we addressed some of the concerns we've had regarding data capture for veterinary services, whether that's health certificates or how the information is actually able to be used by the industry. So hopefully there's some efforts going on, and they are looking at, from her perspective, she was looking at more user interface and user experience feedback. So hopefully that will come down through veterinary services to us so that we can get industry needs put forth regarding the data that we need to help us support the industry.
Yeah, thanks, Katie. Okay, so Tuesday, we had a diversity, equity, and inclusion update from the AHC task force, followed by a presentation from
Recording in progress.
Amber Tariq. She's with the Outdoor Recreation Roundtable, which represents all outdoor recreation activities. And they have a new program called Together Outdoors that we've been working with. And so fascinating to hear some of the things they're doing. And they are offering some fantastic grants to underrepresented communities who are doing outdoor recreation events. So we've got some new opportunities there to bring in some of the smaller segments of the industry who are doing some great work in, say, urban areas or in underrepresented communities. John Blackburn was with us from Blackburn Architecture. He represented the Equine Land Conservation Resource. He talked a lot about some things that he thinks are good practices that people should employ when they are thinking about designing their facilities and being mindful of horse welfare. And so really a great conversation. And we closed that morning with a presentation called The Regulatory Playbook, How It All Works, and a fantastic presentation by Jennifer Reynolds from the University of Maryland and Sandra Tenbrook of the University of Florida about manure management. So I've got their slides, and we think that's a really helpful content there. So anybody interested in that, just reach out to me. I will tell you just quickly, because I'm running out of time, we spent Tuesday afternoon and Wednesday setting up meetings for the attendees to meet with federal agencies, from FTC to Department of Interior to National Park Service to USDA. So a shout out to Dr. Brault. She and her colleagues made themselves available for a lot of stakeholders to meet with them and express their concerns or ask their questions. So thank you so much, Dr. Brault, for that. And then we had, I think, somewhere between 25 and 30 Hill visits in the House, in the Senate, lots and lots of meetings, expressing what our priorities are. And I have a priorities sheet that we left in each of those offices if anybody's interested in seeing what that's all about. Predominantly, we are really honing in on the Farm Bill this year. That's a big ticket item for us, and a couple of things that are in that. So Dr. Flynn, with that, I'll give you back the floor.
Thanks, Julie. Any questions for Julie regarding the American Horse Council meeting? A couple comments I'm just going to add while people are thinking of it. The most pertinent things that are typical for our health committee or these type of health calls, I will tell you that there was very good discussion regarding the disposal challenges related to euthanasia and disposal. And as USDA, or excuse me, as we move forward in our restrictions on the use of some of these chemicals and how are we going to dispose of these carcasses, I do think that FDA is listening to our challenges and as well as AVMA to address some of these. And so if you are interested in those slides that were presented, I really would encourage you to reach out to Julie because I think those are going to be some challenges that we all have faced from a state perspective over the years. So that information was working on getting feedback from the industry. So any other comments, questions?
Katie, I'll just add one thing because I saw it in the chat. Please, all of you that work for federal agencies, be aware that we extended a complimentary invitation to all the agencies to send staff. And I know that that's an interesting process because, for example, we heard from one agency saying, well, we have to ask permission and we have to get approval and we can only send you one. We can't send more than one, but we invited USDA leadership. We invited Department of Interior, Park Service, Forest Service. We invited everybody. If you've got somebody on your staff that has an interest in the content, then here's a complimentary registration. So if that didn't trickle down to you, by all means, give me your name. So next year I'll make sure I get to you.
Okay, any other questions or comments? Hearing none, thank you very much, Julie, to you and staff for a wonderful conference.
Thanks, Katie.
All right, we're going to transition to high path avian influenza and impact on horses, or perspective from USDA. This is a follow-up to our last month's call, as I've received several questions about testing and what happens if what's our plan if we do get a detection in horses. So I'm going to open it up to Dr. Stephanie Brault and Dr. Angela Pelzel-McCluskey. So whichever one of you wants to start.
Hi, can you hear me? This is Dr.
Yep.
Brault.
Got you,
Great.
Stephanie. Go ahead.
I'm glad it's working. So thanks very much for the invitation to speak on this and to just continue the conversation around, our concerns about high path avian influenza and horses. And so I'm going to share a screen, which hopefully will work.
Give me a second, because is it working? Okay, good. You are in presenter mode, so you're going to have to change it.
Still, okay.
Mm-hmm.
Because yeah, I'm on, let me see if I can change the screen I'm sharing, because I am on the presentation mode on one of my monitors. So let's try this. How's that?
Yep, you got it. Go for it.
Yay. Okay. So I am here. Dr. Angela is here. Pelzel-McCluskey is here as well. So after I get done sharing the information and you have any further questions, we're happy to address those. So just as a general high overview, highly pathogenic avian influenza is a contagious viral disease, and usually we're more concerned about it in our domestic and wild birds that it can be deadly to them. There's a lot of different strains. We have been coping with an ongoing outbreak of HPAI since February 2022 in the United States. That current strain of HPAI that we've been dealing with is H5N1. And I wanted to just share a couple of just resources with you that we have online. And so I'll see if I can get these to open and then get shared over. So this website is just an overview of avian influenza. It's really more geared toward the, the avian side of things. This one shows the detections. There's quite good resources online where you can go to this page, and it's under, we just had a website revamp. And so if you're you would go to animal health, and then kind of go through those carrots to get to the detections. And then that's where we have information about commercial and backyard flocks, wild birds, mammals, and livestock. So just to outline the impact that it's had just in birds so far, since, as of yesterday, the date for the data, since the start of the outbreak on February 8th, 2022, we've had 96.81 million birds affected in the United States, a total of 1,150 flocks in 48 states. So it's had a huge impact, as I know you're all aware, especially those of you who are state animal health officials. It's had a huge impact on our avians in the United States already, and has been a huge resource drain. ranging from USDA to our state animal health officials and beyond. So that's our background. And now, you know, as we go through, as we have in the birds, we have, of course, seen HPAI in mammals. There's a lot of species that are potentially susceptible. We've seen it in a range of animals during this outbreak and in previous outbreaks. And then this page is really nice because it shows all those detections in mammals. There's a map that has, you know, all the different sorts of animals that we've seen it in. And then those are also listed out in an Excel spreadsheet. So if you have interest in understanding what other animals, the diversity of animals that have been affected, this is a great resource. So moving on to dairy cattle, which was, you know, unexpected. It's an emerging disease now that we're seeing in dairy cattle. And there's a lot of ongoing work done in the epidemiology of this disease in dairy cattle. There was a federal order issued early in the start of when it was first recognized. And the federal order requires mandatory testing of lactating dairy cattle prior to interstate movement, and except if that movement is direct to slaughter. And it also requires the reporting of positive influenza A test results from livestock. The federal order can be found here. If you go back to the sources that I showed you before that showed the detections in livestock, that information is under there. What I wanted to share with you, and actually I can show it to you here. So this is the page where you would find a lot of information about the ongoing work being done in livestock. So there's a whole list. The federal order is kind of here near the bottom. And then there's a whole list of updates to that information that helps, you know, clarifications to the federal order, very specific and more specific information about dairies, beef cattle. This is hot off the presses. Just today, there was released a really nice resource that I'll show you. That is just the epidemiology work briefly that's been done so far in the dairy cattle. And I just heard a presentation on this the hour before I joined this call. And they have a lot of really great new information, or new information that we've gotten, and it's shared here in a really nice way. So I'd encourage you to go here to get information about this specific emerging disease that we're seeing in dairy cattle. So on to horses, which is what you all came for. So as we know, horses are they're affected by their unique equine lineage, H3N8, which almost certainly, and I think you could probably say with certainty in the distant past, did come from an avian source, but since then has been circulating in horses. And sometimes we've had some spillover events, for example, into dogs, but it's our horse lineage. As Dr. Chambers shared with us last month, we have had H5N1 in 2010 that was reported in donkeys in Egypt. And in those donkeys were described to have respiratory signs. And so what this all breaks down to is that we are concerned about horses. There is definitely a possibility that they could be susceptible to H5N1, especially in those animals that are in really close contact with other species that are affected. And that is where we have seen these spillover events happening previously. We've seen, or during this current outbreak, we've seen it in kid goats. We've seen it now in some alpacas, and they've had some very close contact with affected animals. And we're on affected premises, and we did see clinical signs and infections in those animals. And so we could see in horses, we don't know what we're going to see. It could be similar to what we see with horses that have H3N8 influenza. So like the donkeys, did have disease that was respiratory in nature, but in the cattle and the other species that we've seen, they have not been picked up because they've been coughing. They have had other clinical signs that are quite variable. And so, for example, in cats, we've seen neurologic signs, we've seen abortions, we've seen illness in young animals. And so I think we need to have our antennae up for some sort of odd presentations of disease, especially in animals that are in close contact with HPI affected species. So what do we do if you're in a situation where you do see some unusual signs of disease, or potentially you have a horse that had clinical signs that were suggestive of respiratory disease, or maybe it was a neurological animal and it had a panel performed and the H3N8 influenza that maybe was included in some sort of panels that were used was negative. What should you do? What should happen is that should be reported to the state animal health official and the APHIS area veterinarian in charge, or the AVIC. And then they will treat that. Ideally, what we would like is for that to be treated as a foreign animal disease investigation, and then have samples collected and sent to very specific labs for testing. And so what would either happen is that those samples would be sent to a NALN lab, so one of the national labs that are affiliated with our National Veterinary Services Laboratories, or in some instances, they may be sent directly to NVSL itself. But they would be able to provide that guidance that's going to be needed for appropriate sampling and testing. The appropriate samples are really going to depend upon what sort of syndromic signs that the horse is showing or the equid is showing. And so that's going to vary. And so we need to just be sure that everyone is on the same page as far as what type of samples to collect, how those should be handled, and where they should be forwarded. Just to again reiterate, it's very important for everyone to be doing, thinking about this and their potential differentials for some of these unusual presentations that we may see. So just to touch briefly on the risk to humans, CDC currently considers that risk to the public to be low. But if there are people that have close, prolonged, unprotected exposures to infected animals and also their environments, they may be at more risk. And there have been a couple of cases now reported. And so what I wanted to share with you was the CDC's reference that they have published, and it's interim recommendations for basically the public health aspects. And so in here, there's some good recommendations for personal protective equipment, how you can, what you might expect to see, what you should, just recommendations for what to do, what you might be looking for. And I think it's a really great reference for people on this topic. Finally, preventing equine exposure to HPAI. I think it really comes down to the basics. You need to practice really good routine biosecurity, and that might include entry restrictions. So you're not going to be letting vehicles, people come onto your premises that may have had contact with HPAI. You're going to be looking very closely at the health of the horses on your premises, and also doing any appropriate cleaning and disinfection. Just to share, as I'm sure you're all aware, there's some very good biosecurity resources on the Equine Disease Communication Center, and also the American Association of Equine Practitioners. Again, to just emphasize, if you have any unusual sickness, deaths, and equids, any other domestic or wild animal on your premises, talk to your accredited veterinarian and work with your SAHO and AVIC. And then just basic biosecurity, again, what we have seen is HPAI spillover events in these different species has occurred when there is that close contact between HPI affected animals and these sort of atypical species. And so avoid housing multiple species of animals close together. If you notice any sort of signs of clinical disease in any of your animals, by all means segregate immediately and get the appropriate testing done. So that concludes what I was going to share. Here's my contact information and Dr. Pelzel-McCluskey's contact information. Angela, did you have anything that you wanted to add to what I shared today before we take questions?
No, great overview, Stephanie. Thank you so much. We'll just be here for questions.
Thanks, Stephanie. Great overview, as Angela said. I did receive 2 questions and they're both kind of similar. One says, who will pay for the test on suspect equine cases? And the other one says, if we're treating it as an FAD, as the state or federal government paying for these tests? So same question.
So it was basically, sorry, about who would pay for the test?
Yep.
Okay. In my understanding that as an FAD, this would be covered by would work out the payment for that test, and the submitter would not pay. Angela, do you have anything to add for that?
That's correct. So all of our FAD submissions that go either to NVSL or a non-lab are absorbed at the laboratory. So they're part of our non-billable testing strategy. So we would expect, if the right pathways are used, that would be non-billable testing at the appropriate lab.
And of
Okay,
course, that would, I'm just was going to add, Katie, that would, of course, require that everyone was in agreement that this was an appropriate testing to be done.
And that kind of goes into the next question that was asked, Stephanie, is if a horse tests negative for a respiratory panel, would it be recommended to test this horse for this avian influenza?
My personal, this is my recommendation. And of course, like I said, this is something that gets worked out with the SAHO and the ABIC. But from my standpoint, if you have a horse that is showing respiratory signs that are consistent with influenza, for example, it's negative on a broad panel that includes influenza and other common causes or recognized causes of respiratory disease, I think it would be indicated at that point to further test for, do the general matrix testing for influenza A in order to ensure that we're not missing something of that nature. So that would be the way I would approach it.
And a similar question was asked, and it says, does the respiratory panels for influenza pick up this virus?
Well, that's a really great question, Dr. Flynn. To my knowledge, most of the testing being done out in the landscape is specific testing, but I know that there are many people on this call who are probably better able to address that question than I am. And so I would open it out to anyone out there doing testing. What is the specificity of your test?
This is Chris Lance with NVSL, and I can just chime in that influenza A specific assays, so like the general influenza A assays will pick it up, but the more type specific equine influenza assays would not. So it would be important to look at what assay was tested.
Thanks, Chris. And I think that answers the question.
Yeah.
Okay, those are all I have right now. If you have any questions related to this topic, please put them in the chat or unmute your line. There is one question that came in regarding quarantine of a positive if it were to be detected. What is the process and what is the length of quarantine?
I can take that one, Katie. So guys, as you know, we don't have an exit strategy yet, even for the dairy cattle situation. So that a quarantine length or how to get off of a potential quarantine would be determined. We don't have that in hand right now, even for the ongoing incident in dairy cattle. So be patient with us. These are procedures and policies that are being developed and are being discussed. So nothing specific at this time, but just a reminder that the quarantines being placed are being placed by state veterinarians' offices. So these are state animal health official quarantines, and they would be the ultimate determinant of how to remove the quarantine, although we're all trying to work together to establish some of those policies and procedures now.
I don't know if you all can answer this question, but is there any horses that have been tested for this?
My understanding is that there have been horses that have been tested. There's no at least from my position, there's no visibility on all the testing being done. I don't know, Dr. Lance, if that's something that you could share any information on.
What I could say is that we have not identified any H5 positive horses or been notified of any H5 positive detections. Be aware that all of the non-laboratories and also private laboratories, because of the cattle event, are very aware that if they get H5 non-negatives, even in species that get other influenzas, that those are expected to be forwarded to NVSL for confirmation. The testing at the non-level, if they have negative tests or tests that are influenza A positive but are found to be, normal equine influenza strains, none of that would kind of roll up for reporting. So I can't say there's a denominator, and I can't say how many tests would have been conducted. But from that standpoint, there have been no detections reported or confirmed. We have done a little bit of just characterization. We are offering to characterize when somebody has concern about an influenza from an equine. And so far, those have all been very normal equine influenza viruses.
Great, thanks, Chris. Well, I think we're coming to the end of the hour, so I want to say thank you to all our speakers today. This recording will be posted next week to the Equine Disease Communication Center, and folks can access it from there. As always, I welcome any speaker or topic suggestions, and I thank you all for your time and have a wonderful rest of your week. Thanks, everyone.